Welcome, welcome. Thank you for being on today. I want to introduce myself first. I'm Lewis Colin. As John said, I'm one of the board members with the Volunteers of America Southeast Louisiana. And I just have to say, it's such an honor and a privilege to be part of this great board and this great program. There's so much that this program does with Volunteers of America throughout Southeast Louisiana. And one of the things I've always valued, if I'm going to spend my time, my money, my talents, and my treasures, I want to do it for something that's worthwhile. And that's what the Volunteers of America has proven to be and is today. It is really something that to whom much is given, much is required, that we can continue to do great things with the Volunteers of America. So I'm honored to be a part of it. At this time, I ask everybody to go ahead and mute your phones so we won't have any interruption with the program on hand today. The Volunteers of America Southeast Louisiana serves a multitude of people through more than 20 programs. Isn't that amazing? But today, we want to take a deep dive on behavioral health issues in our community. Addressing social determinants of health is a key to providing behavioral health services to people in need of permanent housing. I would like to now introduce you today to the Volunteers of Southeast Louisiana President and CEO, Voris Vegan. Voris?
Good morning, everyone, and thank you, Louis. I appreciate the introduction. And thank you to all of you who are attending the 9th Community Forum that Volunteers America Southeast Louisiana is hosting. I want to give special thanks to Sharon Crespo of ViaLink, Lashonda Williams of NAMI, Louisiana, and Dr. Rosanna Daquiro from the Jefferson Parish Human Service Authority for joining us, and our own Melissa Haley for being a part of this panel. By engaging members of the community, public officials, and donors, we hope to find new needs and opportunities for collaboration to benefit the people we serve. At the same time, we love spreading the word about the work that we do every day. Our frontline workers are out there serving the most vulnerable people in our community. And so today is really exciting for us because today we are celebrating 126 years of service. This is our 126th anniversary for Volunteers America. In New York, our founders, Maud and Valentin Booth, back in 1896, in the spring of 1896, they had a team who was sent to here to Louisiana to help with the yellow fever epidemic here in New Orleans, which began about 126 years ago. And they came here to help the people of Southeast Louisiana. Now, today we have over 20 plus programs, human services programs, that serve more than 61,000 people across a 16 parish area. And that is phenomenal. And we're thankful to our staff every day for doing that great work. But what does it take to support the men and women and children of our community? That's really what's important. Each year, we face a funding gap, the difference between what government support and the grants that are provided in order to provide the services to our folks, and some of our most critical services at that. Now, we do understand that we have more work to do for children, veterans, seniors, and those who struggle with addiction, and so many more. It is not impossible to make this climb when there are people like you who are joining us today who believe in our mission and the work that we do. So today's discussion is about how Volunteers of America, along with community partners, are going to work to address social determinants of behavioral health. And you're probably asking, what are social determinants? And that includes safe and affordable housing, access to education and jobs, and availability of healthy food. Food insecurity is a huge issue in our community. So we want to make sure people have the necessary food in order to remain healthy. And we know that in order for us to do the work for the people we serve and the consumers. In order for them to build skills, we need to address their social determinants of health, especially permanent housing, especially permanent housing. It's fitting that we focus on this topic in March because March is also Social Work Month. And we recognize our social workers who serve as behavioral health professionals. And so, you know, not only our anniversary today, 126 years of service, March is Social Work Month, and then also today is International Women's Day. So we thank those women who are out there paying it forward in the community and making sure that the people who most need services are receiving those services. And now I'd like to introduce our Director of Government and Community Relations, Nick Alvarez. Nick?
Thank you so much, Forrest, and thanks everyone for joining us today. I'm excited to have a chance to speak with such an impressive group of panelists for this important discussion. Here at Volunteers of America Southeast Louisiana, addressing social determinants of behavioral health is central to our mission. So today you'll hear more about our behavioral health program and how that supports permanent supportive housing. Now, before I get started, I want to just provide a couple of housekeeping points. Number one, if you have any questions that you'd like to pose to the panel throughout our discussion, please place those in the chat and I'll get to as many as possible throughout the discussion. I also did want to mention that we are going to conclude our session today at 10 till 11. Some of our panelists have 11 o'clock appointments, and so we want to be respectful of everyone's time. So we are going to give you that 10 minutes back at the end of the hour. So with that, I'm going to go ahead and introduce each one of our panelists and then ask them to give a short opening statement to discuss a little bit more about themselves and the work that they do. I'm going to start with Melissa Haley. Melissa Haley is the Vice President of Program Operations here at Volunteers of America Southeast Louisiana. She manages the behavioral health and permanent supportive housing services throughout the 16 parishes served by our agency. Melissa also serves as the 14th president of the National Association of Black Social Workers. Melissa is a Volunteers of America commissioned agency minister. She's a graduate of Xavier University of Louisiana and received her Master of Social Work from Clark Atlanta University. Melissa, I'm going to turn it over to you now to talk a little bit about Volunteers of America's work in behavioral health. Melissa.
Thank you so much, Nick, for the introduction and the opportunity. It is Social Work Month, and as a social worker, second generation social worker, I have been born and raised in the communities that I serve, right? So as a vested member of the community, it is so important to see change, to see growth, and to see development. So in the 25 years that I practiced, the word behavior health was not a common word that you talked about. You talked about mental health and you talked about children and family services. So the development of behavioral health as a discipline is relatively new. And it really addresses the social determinants of health aspect, that there is a direct correlation with your mental health as well as your physical health. People who have mental health issues very often have dilemmas and other challenges that bring those about that has a lot more to do with than just biology, right? So the social determinants of health is something that the CDC acknowledges as a major impairment and implement to stop people from getting the mental health services that we need. So at Volunteers of America, we do holistic services. When we work with clients, we look at care coordination, not just what your mental health diagnosis is. We look at what are your total issues in terms of your health, your physical health, the assessment of your family. And most of all, we look at strengths, right? Because it's important that no matter what a person is going through, whether it's homelessness, whether they're suffering with acute mental health issues, that you look at their strengths, what has gotten them this far, and you build on those strengths to continue. So SDOH, you'll see it, and it's an SD, a little O and H. The social determinants of health really looks at health, mental health, housing, poverty, multiple pillars that bring about total community wellness and wellness for an individual. So it is incumbent on the community to work together to address the social determinants of health, to bring about health equality, and to bring about a sound community.
Thank you so much, Melissa, for that introduction. I think that it's so important for these forums to be an opportunity where we learn about the work of different community organizations, because each of the panelists here represent a different aspect of the mental health and behavioral health workforce and opportunity throughout our Southeast Louisiana region. And so often we hear little bits and pieces of what everyone's doing, but now is the time to bring some critical pieces together. So next I want to introduce Sharon Crespo. Sharon Crespo is ViaLink's Outreach and Traumatic Loss Coordinator. Her professional background is highlighted by her work with suicide education, prevention, intervention, and postvention. Currently, she has clinical oversight of ViaLink's 24/7 call center, along with myriad other efforts to prevent suicide. She is also the program manager for ViaLink's Preventing Child Abuse program. So Sharon, I'm going to turn it over to you now to talk a little bit more about ViaLink's work and what you do every single day to lift up people and to try to prevent suicide, address some of the major behavioral health issues that we have in our community.
Sure. Thank you so much for having me here today. It's a privilege to be here with all of you. I just want to give y'all a quick rundown of what we do at ViaLink and what we offer to the community and how you may be able to incorporate our services for your clients in their continuum of care. So at ViaLink, we are a local nonprofit agency, and we do run a 24-hour contact center. Through our contact center, we do answer the National Suicide Prevention Lifeline for Louisiana, that 1-800-273-TALK number. And for those of you that are familiar with the transition into the 3-digit dialing code 988, we are going to be answering 988 when that happens this year in 2022. Also in our contact center, we serve the state statewide by offering a 24/7 crisis teen text line. That number is 833-TEXT-TEEN, which is a 24-hour line that teens can text to get connected to one of our crisis intervention and suicide intervention specialists. We also offer a phone and text line statewide for parents called Louisiana Parent Line, which offers emotional support for parents. That's available by dialing 833-LA-CHILD or texting 225-424-1533. We also answer a line called the Keeping Calm line, which was launched in response to the COVID-19 pandemic and then all of the following natural disasters that we have had, which is a line for information and referral in relation to the pandemic, in relation to a natural disaster, and also for those that are feeling distress. It's an emotional support line. We do answer 211, which is an information and referral line for health and human services for 10 parishes in Louisiana. Great news about Louisiana is that every parish is covered by a 211 center, where 24 hours a day you can dial 211 from your phone to get connected to a live person who can help you navigate health and human services and find what resources are available in your area. Or you can also text 211 to get connected again to a live person by texting your zip code to 898-211. We also use the information, the data on the needs, the demographics, and the unmet needs to form data dashboards on our website, which is vialink.org, which you can explore for free. It's on our homepage. It says explore our data. And this can be such a useful tool for those that are working in the community, because not only can you see what the needs are in your area by parish, even by zip code, you can also see what those unmet needs are, what people are calling in need of, and there isn't a service available, which is so crucial in program development. And I will say across the board, housing needs are seen in every area of our state. Some of our other programs that we do have at ViaLink, we do have 3 support groups. These are all free. We have 2 support groups for adult survivors of suicide loss, one specific to the New Orleans area, one is available statewide. We also have a support group for teenagers who live with suicide ideation, which is available in the Southeast region of the state. All 3 of these groups are virtual. We provide outreach and education with trainings on suicide education and response, crisis intervention and de-escalation. We also provide ACEs training, adverse childhood experience scale, and darkness to light training, which is for the prevention of child sexual abuse. We also house at ViaLink an HMIS department, which is the Homeless Management and Information Systems for Orleans and Jefferson Parish. So I know that was a lot. So please feel free to go to our website, vialink.org, explore our programs, explore our data. You can follow us on Facebook at vialink/211. And please just connect with us and let us know how we can best help serve you and serve the community.
Thank you very much, Sherrod. I appreciate that. I look forward to our discussion as we get into that segment. And that is, I do want to remind everyone, as you hear everyone give their introductions, if questions come to mind, if there are issues that you hear raised that you want to learn more about, please do put those questions into the chat and I'll get to as many as possible throughout our time this morning. Next, I want to turn to Lashonda Williams. Lashonda Williams is the executive director of NAMI, Louisiana. Lashonda's responsibilities include facilitating workshops and trainings that educate the public regarding crisis management, behavioral health, and various diagnoses, while raising awareness and reducing stigma associated with mental health. She graduated from Southern University Law Center in 2006, and since 2008 has managed a small law firm. Lashonda, I'm going to turn it over to you now.
Good morning, everyone. Thank you, Nick, for that introduction. As mentioned, I do have a small law firm as well as being the executive director. And I actually got started in the mental health field back in 2016, working with Mental Health America as a housing director. In 2018, I transferred the housing director position to NAMI, Louisiana. And in last year, I became the executive director. And just as being an attorney, I've always advocated for clients. And once I got introduced to the mental health world, it was just amazing how much the two just kind of intertwined. I realized that I was not only an advocate for my clients, but I was an advocate for my clients through the housing program. And so we have a program even here at NAMI, Louisiana, where we help people transition that are coming out of jails or mental institutions, hospitals, and we help them to transition back into the world. So we pay their rent for a couple of months and just help them to get back on their feet. And I know that it was mentioned earlier how important it is to make sure that you have sufficient and stable housing. That's a very big determinant in determining how things will play out in the future. So again, it's just been wonderful to be able to use my skills that I learned in law school to be able to work with NAMI Louisiana and help these clients in my housing position. And even as executive director here at NAMI Louisiana, we do a lot of advocating, we educate, we listen, we educate through our signature program.
Not assist her, but assist you in getting what you need.
Just a reminder, everybody, to mute if you're not one of the panelists speaking, but I think we're good, Lashonda.
Okay. I said, oh, did I do something? So as I was mentioning, we have our signature programs through NAMI National that we offer to our members, where we have our NAMI family to family, peer to peer. And these are just programs where we're helping other peers or family members on how to help other family members and peers to deal with their mental health and learning how to cope and just being able to make it in the world. So we do those trainings. We do several workshops and trainings. We do a lot of collaboration with other organizations as well, just to bring that awareness about mental health and trying to reduce that stigma and just learning how to better serve our community and the people in our community.
Excellent. Thank you so much, Lashonda. And again, I look forward to our discussion today. I'm going to now introduce Rosanna Daquiro. Dr. Rosanna Daquiro is the Executive Director of Jefferson Parish Human Services Authority. She has over a decade of experience as a clinician and manager of evidence-based behavioral health programs for children and families. Dr. DiChiro works closely with the Jefferson Parish Sheriff's Office and coroner on the crisis continuum. She has worked for years on projects addressing mental health and housing for those who are unhoused. She's passionate about mental health, public health, and innovation in technology and social services delivery. She is also a national consultant for functional family therapy. Dr. DiChiro, welcome and thank you for being here this morning.
Good morning, everyone. Thank you. Thank you, Nick, for including me. Yes, so as Nick stated, I work for Jefferson Parish Human Services Authority. We are the safety net agency for everyone in Jefferson Parish. We provide mental health services, addiction services, including gambling, and developmental disability services. We also have a federally qualified health center. Therefore, that means we provide primary care services. We believe in being the one-stop shop and including all services for individuals in our community. One of the things that we also do, in addition to, as we've been talking about, social determinants of health, so we have treatment services, the typical services that you're aware of, counseling, whether it's individual counseling, family counseling, group counseling. We do all of that for individuals and families, children, adults, but we also do a lot of support services, things that are maybe not quite as known or as understood that we do at our agency. We talked about housing. Housing is one of the main things that I want to focus on coming up in the coming up year. Housing has gotten even more to be more of an issue with COVID, with the hurricane happening back in August, September. It's increasing and it's becoming more of an issue. We really believe in providing those support services that contribute to social determinants of health. So some of them being, yes, housing is important. You can't address your underlying mental health or substance abuse needs if you are unhoused. You also can't address those issues if you don't have employment, if you don't have food, if you don't have clothing. We provide all of that. Those big support services are important. They augment any treatment services. We have services within our four walls, but we also have community-based services. And by community, I mean out in the community, in the streets where people are, where our clients are, where our service recipients are. You probably have seen on the streets our various peers doing homeless outreach. That is one of the big populations that we like to give back to as peers. We believe in the advancement of those individuals to then provide services to those individuals that we serve. We're going to go out there and find those people and figure out what they individually need to try to provide those services. Our agency's been around for 33 years. We do more than I can probably even describe in the next 5 minutes. If you want more information, please go check out our website. It's www.jphsa.org. We're also on Facebook. We're on Instagram. Again, we serve all of Jefferson Parish. This is a passion for me. It is not something that I just look at a 9-to-5 job. It's something that I truly believe in to benefit the health and wellness of all the individuals in our community. The more healthy everyone can be, not just a certain group of people, but everyone speaking to that health equity, everyone getting access to those services, removing barriers to services, making sure you have care coordination so that your treatment is holistically planned and thorough and detailed and addresses all of your needs is so important for us to have a healthy community. Thank you very much.
Great, thank you so much. Well, let's dive right into discussion. I want to turn to you, Melissa, and because I heard in the introductions a lot about housing. That was a consistent theme, I've got to say. And could you talk a little bit more about Volunteers of America's work in linking behavioral health with permanent supportive housing and what that model really looks like in terms of partnership with the state, how we go about making sure that people have their needs met so that they can maintain stable housing?
I've been fortunate to practice in this community for 25 years. And so I have seen the evolution in the greater New Orleans area of collaboration and how that eases a lot of stress on the people that we serve. So we have a single point of entry in Jefferson Parish is included in that, Orleans Parish, NAMI, ViaLink. They all are included in that, in the same single point of entry. So if you're a person experiencing homelessness, you don't have to go to 5 or 6 agencies to get services. You go through a single point of entry, which is our continuum of care through Unity. And you get on a list and you go through an assessment regarding how vulnerable you are and who needs immediate housing, because the goal is to house as many people as quickly as we can. ViaLink manages that list. So the list that comes through, all of us feed into a list that ViaLink manages in order to ensure that people are getting services in a timely manner, equitably, and in a fair manner. And as a continuum in Greater New Orleans, we've invested in racial equality, diversity, equity, and inclusion, LGBT community services to ensure that people, regardless of if they are immigrants or not, if you're experiencing homelessness in New Orleans, a veteran, we can service you, and we can service you collectively. We're not competitors. We are one team, and we work together to help address issues. And when you look at social determinants of health, you will see that over 50% of the major issues that cause health challenges have to do with socioeconomic environments, where a person lives, what person's economic ability is, what kind of money they have, what kind of education they have. So according to the CDC, that this constitutes 50%. So as Jefferson Parish mentioned, Dr. DiChiro talked about, how do we address holistically the challenges that a person facing on a micro level with the individual, on a meso level with the family, and on a macro level in terms of how do we advocate for justice, equality, and see housing as a fundamental right that everyone should be housed, and we want to provide that space. So we work collaboratively, and we do it so it can be as painless and quickly as possible. Even in New Orleans, we were the first community to do what is called housing. We can house veterans in 14 days or less. So if a veteran presents itself as homeless, that we can work together.
See, you just need to come over here and tell me. Thank you.
Within 14 days. So that is called functional zero. In Louisiana, New Orleans was the first community to achieve that, showing our collective collaboration.
Melissa, that's amazing. And it's great to hear the collaboration that's happening right now and the progress that we have made through the years. I think that brings me to my next question, which is, given the progress that we have made, the collaborations that we do have, you also talked about, the need that there's still much work, of course, to be done to get where we have housing as a right. And I know we're not going to figure it all out in the next 20 minutes, but in terms of next steps, especially as we're coming off, we're still in this pandemic, it's been 2 years, there's new needs. When we talk about what are the things that we need in terms of collaboration or public policy, and this is for any of our panelists who want to jump in, what do y'all see as the issues where we need that next step? If you were able to really, dig in and say, we could use these players talking to one another or these policies in place to really make a difference. What are those top priorities for you in terms of behavioral health and social determinants?
I think a lot of it has to do with that collaboration with important stakeholders. One of the things that we do is we collaborate a lot with the sheriff's office. They are often the first responders that see the homeless individuals out on the streets. We also communicate a lot with our parish council members, with our parish president, because the regular individual out there will see someone in their neighborhood and they don't know who to call and they don't know who to reach. So we have done a lot of outreach with those individuals to say, reach out to me. let me know when you see someone in your community. You don't know who to call, you don't know what to do, to try to make it easy so they don't have to call 12 numbers and figure out who do I reach. It's making sure that all of those important stakeholders in your community know what you do so that they will reach out to you. They don't have to know the specifics of what I do. You know, I saw one of the questions pop up from Dewana Burse about, you know, does JPHSA also have Unity as a point of contact? And we do, but we do a lot of other things with regards to housing as well, with homeless outreach, with providing rental assistance, with if you're about to be evicted, eviction assistance to try to prevent homelessness. It's about making sure people know who to call so that in the moment when they see someone, they can reach out and we can jump in quickly with speed to address whatever issues we can as quickly as possible in the moment.
Nick, I would also just like to piggyback off of what Dr. DiChiro said, and I do hope I pronounced that correctly.
You can just call me Rosanna, it's fine.
Okay. So as mentioned, that collaboration is very important, and just knowing, as they mentioned, just knowing who to contact. We have also started to do a lot of outreach. As I said, we do have a housing program where we provide rental assistance and we contract with different group homes. I know that the Bridge Center in the Baton Rouge area is now open, and we have started reaching out to them as they, you know, get the officers. If there's a situation where where law enforcement comes in contact with someone that's on the streets and don't have anywhere to go, instead of always bringing them to the emergency room or taking them to jail, they may bring them to the Bridge Center. And so we've started reaching out to the Bridge Center to let them know about our housing program. I work a lot with Stark Corporation or LHC and just those different agency stakeholders that, you know, can provide additional resources. And I think for us, it's just very important to make those connections, know the different organizations. I think there's so many resources out there, but we're just unaware at times. So it's so good to come together at times to learn. Just as with Miss Melissa, I had group homes in the New Orleans area, and I was aware of Unity. Now I haven't worked with them in some times, but I know, you know, what they did, and it was just so great when I had clients that were in the New Orleans area. I can actually tell them, listen, contact VOA, contact Unity. They can help you. They can assist you with different things. So I think we just need to be aware and have more of those connections, more people coming forth and saying, this is what we do. Let's all get together. Let's collaborate. Let's work together, because again, as mentioned earlier, we're all working towards the same goal. So it's not competition. We all want the same thing, and that's for our communities to be better and stronger and healthy. So again, I think it's just more collaborations in working with more organizations and agencies.
You know, it's multidiscipline work. You know, I said it's social work month, but, you know, we're change agents. So it's incumbent on all change agents, regardless. We have a clinician, we have an attorney, we have social workers. We all need multiple services in order to help people self-actualize, because that's the whole goal, right? For you to identify your strengths, to reach your best self, and to utilize that. But it's also in our best interest as taxpayers, right? So we want to help people get stabilized so they can contribute to the income base of our community, right? As well as not to stress out some of our most sensitive areas. Now, we saw during COVID how taxed we were with emergency rooms, how taxed we were with overnight stays in hospitals. So it's in our financial best interest if we can work to get people housed, to get them preventive care, to get them the services that they need, then they will decrease the uses of the highest cost services, right? So that is the political connection, Nick, in terms of politicians really understanding the cost of homelessness and the cost of emergency service units are really costing us as a state in a way that it would be in our best interest to help people get housed. How can we do that? Rent control, right? How can we do that? We can utilize other services that have been illustrated across the country that we can help people who have some serious issues and help them to be better contributors to our communities, live in a safer community, and have a healthier life.
As well, to piggyback on the collaboration aspect, is knowing what services are already being done. Louisiana has so many wonderful services and people think that we don't. And there are so many agencies that have such passionate people, but sometimes we end up recreating the wheel and putting all of our efforts into a program that might already exist. So the more collaboration we have with each other and forums like this, where you find out what services are actually already being done, that way all these wonderful agencies, that way all these wonderful agencies can devote their passions and their time to where there are gaps in services rather than repeating services.
That's wonderful. I did want to touch on a question that came through the chat. That Melissa, I think you answered in the chat around veteran services, but maybe just for the benefit of everyone, could you talk a little bit about veteran services specifically, and how someone, if they know someone who's a veteran who's unhoused, what they can do?
Like Rosanna, I'm so passionate about this, right? So as you were saying that, Nick, I was typing in the chat, no veteran in the state of Louisiana should be homeless. So if you know a veteran who's experiencing homelessness, tell them to call me. Tell them to call me on my cell phone. I'll put my cell phone in there, right? We have dollars for veterans experiencing homelessness. Yes, there are eligibility requirements, definitely, right? But most of the requirements allow homeless prevention and rapid rehousing. We also can get legal services for veterans who have bad discharges, who are experiencing homelessness, veterans who have challenges with expunging of records and things of that nature. So millions of dollars have come into the state of Louisiana. We've demonstrated that we can house veterans, and no veteran should be experiencing homelessness. So some of y'all say, I see a veteran with a sign, right? I see him holding and saying that I'm experiencing homelessness. Trust me, we've talked to them. We've assisted them. We know, or tell them, have you talked to Volunteers of America? Because we can house them if they, with minor eligibility requirements, or connect them to other services. So I'm going to put the number that you can contact in the chat, but so much money is available for veterans in particular that should not be a problem that the state is experiencing.
Thank you, Melissa. That's wonderful. And I do want to direct everyone, if you haven't already, check out the chat, because people are sharing resources, people are sharing contact information. And if you have websites, I've mentioned some things, please check it out, because I think that is something that is worth looking at. And we will follow up with an email to all the participants that puts all this information into an email as well, in case you are on your phone or you're not able to access the chat at this time. So I want to turn to another question. So something so important about this work, in that I've heard mentioned by a couple of panelists, is racial equity and health equity. How can we ensure that those equity concerns and that an equity lens is brought to this work of behavioral health and social determinants as we're looking at the challenges that our community faces? And I present that to any panelist who wants to jump in.
So I'll start, because I know the ladies have so much to say. I'm just going to let y'all jump right on in, right? So what I will start with, that we have to accept the fact that there is inequity. It's a fact. And if you don't believe me, Google it. Is there a racial inequity in America? Yes, the CDC will say that there's classism, racism. There are different problems that even goes further, that it causes over 50% of the challenges. So if we start first with saying this is not an enigma, that these are facts that demonstrate what are some of the discrepancies? So I would say the first thing that we have to do is realize that that is a reality that we have in this country. And then look at, once we accept it, how we can address it.
And to piggyback on what Melissa said, I think also being aware that you don't know everything as a provider, asking, knowing that you need to ask, knowing that it's okay to ask, being aware of it, recognizing it, and at the same time, doing research and education to benefit you and your client as well, so that you know what it is that's going on out there. I think that awareness is the most important thing. One of the things that we're doing at my agency is we're talking about it. Let's get people at the table and talk about it, because I acknowledge and I'm aware I don't know everything, and I want to hear from other people and other individuals. And even asking our service recipients in the community, what do you need? What is your experience, so that I can hear it directly from the source.
I think, yeah, I totally agree. And that not only being aware of inequity in people's experiences, but validating that experience. We so often as helpers and caring people want to just kind of glass half full a situation, thinking that that's going to be more helpful when it's actually fairly dismissive, and really kind of getting on the floor with someone, validating their emotions, validating their feelings is much more helpful and a much better starting place. Even just telling someone this is unfair and it sucks, but I want to try and help you, can be a lot more validating than saying, oh, well, you don't have to worry about that, it's going to be better, which might dismiss someone's experience. And just realizing the huge effects of inequities through gender, through race, that it increases feelings of isolation, of helplessness, of hopelessness, which increase suicide risk. And knowing that this across the board, physically, biologically, mentally, is putting people's lives at risk.
And I will say, as New Orleanians and Louisianans, we have experienced homelessness unexpectedly on multiple occasions, right? And so, no matter how many degrees you had, if Katrina hit and you were in a community that was ravaged, then you had to relocate. And if you think about the challenges that you had until you found out where your kids were going to be, where they were going to go to school, where this thing was going to happen, that you really couldn't focus, right? And so that is really the whole concept and the evidence-based practice that we're committed to in this community, is that housing is first. That once you house a person, then a person has a roof over their head, a place to sleep, then you can start addressing physical health, mental health, all of those challenges that they are facing. But we commit as a community of providers that housing is first. And once we get that settled, then we can work with the client on an ongoing basis for permanency.
So we've got about 6 minutes left, and so we're nearing our end, even though it seems like there's so much more to talk about, because there frankly is a lot more to talk about. So I want to get everyone's concluding thoughts and really just what should be a take-home message for everyone on this call. We've got 43 people here who are looking to get more information, more resources, more ideas for addressing behavioral health and social determinants. So I'm going to take us kind of in a reverse order from our starting place. So Rosanna, I'm going to turn to you first for any closing thoughts you've got and take-home messages for everyone on the call.
One of the things is there are resources out there. There is services out there, and you don't necessarily know everything that's out there. I think, like Ms. Crespo said, you're reinventing the wheel sometimes because you don't know what's out there. I think these community forums are great because it helps us all know in the community what is out there. I knew a lot of what ViaLink did. I even wrote down a couple of things like, oh, I didn't know that. One of the things I would like to do, the Jefferson Parish has a behavioral health task force. It's been going on for probably over 2 decades at this point. And it is a community of providers that come together once a month. It used to be face-to-face, and everything was pre-COVID. It was face-to-face, but now it's in a virtual setting like this. And anytime I come across a new provider, Nick, you being one of them, I'm like, please come to this so that we can all, as many people, get together and share in a quick blurb of here's what I do, here's I exist, so that we know, because knowledge is power. The more you know what's out there, the more you can help the individuals that you serve. So I'm going to put that in the chat as well about the Behavioral Health Task Force, and I can send out a link later on, Nick, that you can include for how to attend going forward.
That would be excellent. And, we're getting, again, a lot of resources in the chat. So everyone take a look, but we will also record all that information and put it into an email where it's easily digestible. So I want to turn to Lashonda now with your closing thoughts and take-home messages.
And again, it's kind of piggybacking off of what Roseanne said, but I think it's very important to collaborate, because I think the more people that come together, the more changes that we can all make. And it's much easier when it's a group of people working together. As she mentioned, one person, or we don't know everything. One organization doesn't know it all. But if we can continue collaborating and continue listening, because a lot of times there's so much happening that we hear, but sometimes you're just not taking the time to actually listen. So I think when we listen, we can know how to move forward and learn or research the areas that may be lacking. So again, I think it's that collaboration, getting the additional resources, and just basically listening so we can know how to make those changes and how to work together to bring about those changes. And as mentioned with the task force, I know that NAMI Louisiana is a part of different task force as well as coalitions. So again, I think the more that we come together and work together, the more changes that we can see happen and that we can bring about. So we can all, our voices need to be heard. And I think that's a very important thing, to make sure that we're addressing those needs that's out there in the community, because there's so much happening and so much going on. And also just the housing, I think that is also a very important issue. As I said, I know that ViaLink has their housing component. Dr. Rosanna has their housing component. NAMI Louisiana has a housing component. So again, I think we just all need to work together and figure out how, even between us three or us four right now, can work together to make things happen. There may be ways that we can, there's some things we can do and some things we can't do. So how can I work with everybody else that's here to see how we can better and make and get the individuals better as well? So.
Great, thank you so much. Sherrard, your closing thoughts and take-home messages.
Yeah, I just basically agree with what everyone is saying. Collaboration and realizing that, physical health is mental health. When someone does not have a home, when someone does not have access to food, access to healthcare, there is no way that they can focus on and address their emotional needs or their emotional stress, because their physical needs are not being met. So we cannot address mental health without addressing these physical needs that are in our community. And we can do that through this collaboration. We were hearing about so many wonderful resources today. Please, I encourage you, if you have an agency that provides health and human service needs, make sure it's included in your areas 211. You can just email us through vialink.org through our website. We'll make sure that your agency is included. You can search on our website for your agency, and you can update your agency program. So making sure that the 211 centers have all the information about what your agencies and your programs offer is crucial for this collaboration.
Great, thank you, Sharon. And I'm gonna give Melissa Haley the last word. Before I do, I also want to mention that, one of the structures we have in place here in Louisiana is the Louisiana Mental Health Coalition. And that coalition has recently started some work groups. So in the follow-up email, I'm going to provide some information about that without going into too much detail right now, but there's work emerging around school-based mental health, about criminal justice in mental health, and also around crisis continuum and mental health. But I want to turn now to Melissa Haley for final thoughts and take-home messages.
Well, I want to say at Volunteers of America Southeast Louisiana, you really can get a feel of who we are and what we do by the success stories. And we have a lot of success stories from people going from homelessness to housed, from people going from unemployment to employed, from people going from poverty to home ownership. So we really work the continuum in multiple areas in order to help people to really identify and reach their goals. And I would love for you to come to Volunteers of America. You can see what we do. On April 27th, we will definitely have our breakfast where we will showcase success stories, and you can see change agents, people who actually do the work, who are in the community on a regular basis. So I would love for you to come see what we do, come see what our communities do together and collectively. We are not competitors. We are passionate about liberating people from oppression. We are passionate about ensuring that everyone in our community is housed. So please remember, housing is first, and we got proof how great we do it in this community. So thank you for joining us, and it was great to talk to you about what we do every day.
Great, thanks everybody. As I said, I'm going to be following up with an email to everyone, and let's keep this conversation going. We've only had a short time this morning, but I hope that everyone takes at least one or two take-home messages with them, and we'll be following up with lots of resources. And please don't hesitate to reach out if there are follow-up questions that you have for any of our panelists. But with that, I'm going to give you all 8 minutes back of your morning.